Levofloxacin is a powerful antibiotic, often given for chest infections, urinary tract infections, or sinus problems. Doctors prescribe it because it works fast and kills tough bacteria. But what most people don't realize is that this medicine also carries serious risks. Some of its side effects are rare, but when they happen, they can be life-changing. They can harm your nerves, tendons, liver, and even your heart. And the most worrying part? These issues can appear suddenly, even after you stop taking the drug. That's why today, we will talk about 9 dangerous side effects of levofloxacin that you should never ignore. This is not to scare you, but to prepare you. If you or someone you know is taking this medicine, knowing these warning signs could save your health, or even your life. So, let's start with the first and most well-known danger. Before we begin, here's an important reminder. This video is for educational purposes only. I am not your doctor, and this is not medical advice. Levofloxacin can be a life-saving medicine when used correctly, but it also carries risks that you should understand. Every person is different, and only your healthcare provider knows what is right for you. If you are already taking levofloxacin, do not stop or change your dose on your own. If you notice anything unusual, talk to your doctor immediately. The goal of this video is simple: to help you recognize possible dangers early so that you don't ignore them. Many times, people dismiss small symptoms, not realizing they could be a sign of something serious. So please listen carefully, stay informed, and always put your health first. With that said, let's go through the 9 dangerous side effects, starting with tendon problems. 1. Tendon pain or rupture. One of the most serious side effects of levofloxacin is tendon damage. Tendons connect your muscles to your bones, and normally they are very strong. But with this medicine, they can weaken and even tear. The Achilles tendon, located at the back of your ankle, is most often affected. The signs may start with sudden pain, swelling, stiffness, or a snapping sensation while walking or exercising. In severe cases, the tendon can rupture completely, making it difficult or impossible to move normally. What's even more alarming is that this side effect may occur during treatment or months after you stop taking the drug. Older adults, people with kidney problems, and those using steroids are at higher risk. A ruptured tendon may need surgery and can cause long-term disability. That's why tendon pain while taking levofloxacin should never be ignored. If you feel it, stop activity and seek medical care quickly. 2. Peripheral neuropathy. Another dangerous risk is peripheral neuropathy, which means nerve damage. This problem often begins as tingling, burning, or numbness in the hands, feet, arms, or legs. Some patients describe it as pins and needles, while others feel sharp stabbing pain. Unlike mild side effects that go away, nerve damage can be permanent. Even after you stop the medicine, the symptoms may remain or worsen. This makes it one of the most concerning complications of levofloxacin. Anyone can be affected, but people with diabetes or pre-existing nerve issues are at higher risk. The key warning signs are loss of sensation, weakness, or unusual pain in the limbs. If you experience these changes, do not ignore them or wait for them to pass. Report them immediately to your doctor. Early action may help prevent permanent damage. Nerve health is delicate, and protecting it should always be a top priority. 3. Central nervous system problems. 150 words. Levofloxacin can also affect your brain and nervous system. Some people develop anxiety, confusion, restlessness, or difficulty sleeping. Others may experience dizziness, hallucinations, depression, or even seizures. In rare cases, it may trigger suicidal thoughts or psychotic episodes. These effects can appear within hours of the first dose, making them especially dangerous. Older adults and patients with existing mental health conditions or seizure disorders are more vulnerable. Because these symptoms can be unpredictable, it's important not to dismiss them as stress or fatigue. If you suddenly feel mentally different while on levofloxacin, such as unusual fear, severe mood swings, or loss of focus, take it seriously. Talk to your doctor immediately. Mental health is just as important as physical health, and this antibiotic has been linked to sudden and severe reactions in some patients. Your safety comes first, so never ignore unexpected changes in your mood or behavior. For liver injury, 150 words, levofloxacin can also harm your liver. Though rare, this effect can be severe and even life-threatening. The liver is your body's main detox organ, and when it's damaged, the signs can show up quickly. Watch for symptoms like yellowing of the skin or eyes, dark-colored urine, stomach pain, unusual fatigue, or nausea. These are signals of hepatitis or other serious liver problems. People with pre-existing liver conditions are at higher risk, but it can happen to anyone. The danger is that many patients confuse these symptoms with common sickness or tiredness. Ignoring them can make the damage worse. If you notice these warning signs, stop the medicine and seek medical help immediately. Liver injury from levofloxacin may be rare, but when it occurs, it requires urgent treatment. Protecting your liver is essential, because without it, your body cannot filter toxins or maintain overall health properly. 5 severe allergic reactions. Like many antibiotics, levofloxacin can cause allergic reactions, but some can be life-threatening. The most dangerous form is anaphylaxis, which can strike suddenly. Signs include skin rash, itching, hives, swelling of the lips or face, and difficulty breathing. In some cases, the throat or tongue may swell, making it hard to breathe or swallow. This is a medical emergency and requires immediate treatment. Even mild reactions, such as itching or rashes, should not be ignored, because they can progress quickly. People with a history of allergies to other antibiotics may be at higher risk. If you ever feel your throat tightening, your chest becoming heavy, or notice swelling while on levofloxacin, call for help right away. Allergic reactions can turn fatal within minutes. Your best protection is awareness and quick action. Never assume a reaction is small or harmless when dealing with strong medicines like this. 6. Heart rhythm changes. Levofloxacin can also affect your heart. One of the major risks is QT prolongation, a change in the heart's electrical rhythm. This condition can cause an irregular or fast heartbeat, dizziness, or fainting. In rare cases, it may lead to dangerous arrhythmias that can be life-threatening. People with existing heart conditions, those taking certain heart medications, or patients with low potassium or magnesium are more at risk. The symptoms to watch for include palpitations, chest discomfort, lightheadedness, or sudden fainting. These signs should never be ignored, as they may indicate a serious problem. Doctors sometimes monitor patients with an ECG if they need levofloxacin for a long period. If you feel your heart racing or skipping beats while on this medicine, seek medical attention immediately. Heart health is critical, and any unusual rhythm changes during treatment should be taken as a serious warning. 7. Aortic aneurysm or dissection. Another rare but very dangerous risk of levofloxacin is weakening of the aorta, the main blood vessel carrying blood from your heart to the rest of the body. This can lead to an aortic aneurysm or even a tear, called an aortic dissection. The symptoms may include sudden, severe chest pain, back pain, or abdominal pain, along with difficulty breathing. These conditions are life-threatening emergencies. Research suggests that people with high blood pressure, heart disease, or existing vessel problems may be more vulnerable. While this side effect is rare, it is extremely serious and should not be taken lightly. If you experience sudden unexplained pain in your chest, back, or stomach while taking levofloxacin, get emergency help immediately. Quick action can save your life. This shows that while antibiotics fight infections, they can also carry risks that affect major parts of the body, including blood vessels. 8. C. diff colitis. Levofloxacin, like many antibiotics, can disturb the balance of good and bad bacteria in your gut. This sometimes leads to a dangerous infection called Clostridioides difficile colitis, or simply C. diff. The symptoms include severe diarrhea, stomach cramps, fever, and dehydration. In the worst cases, it can cause swelling of the colon, intestinal damage, or even death. What makes this tricky is that diarrhea is often dismissed as the common side effect of antibiotics. But with C. diff, the diarrhea is usually watery, frequent, and persistent. It does not improve on its own and may worsen over time. If you notice these symptoms during or after taking levofloxacin, seek medical attention right away. C. diff can spread quickly inside hospitals or communities, making it especially dangerous. Protecting your gut health is important, and any severe digestive changes during treatment should always be taken seriously. 9. Hypoglycemia. The last major side effect is hypoglycemia, or dangerously low blood sugar. This is most common in people with diabetes, especially those taking insulin or other blood sugar-lowering medicines. However, it can also affect people without diabetes. The symptoms include sweating, shakiness, confusion, fast heartbeat, dizziness, or fainting. If left untreated, severe hypoglycemia can cause seizures, loss of consciousness, or even death. Many patients confuse these signs with normal tiredness or hunger, which makes the risk even greater. If you are on levofloxacin and notice sudden weakness, blurry vision, or unusual sweating, check your blood sugar immediately if possible, and contact your doctor. In severe cases, call for emergency help. Managing blood sugar levels is vital for overall health, and this antibiotic can sometimes interfere with that balance. Awareness of this risk can help you act quickly and avoid serious complications. Now you know the 9 most dangerous side effects of levofloxacin. While this medicine can fight serious infections, it should never be taken lightly. Tendon damage, nerve problems, liver injury, heart rhythm changes, and other complications are real risks, even if they are not common. The key message is simple: stay alert. If you ever notice unusual symptoms while taking levofloxacin, whether it's pain, numbness, chest discomfort, sudden weakness, or persistent diarrhea, don't ignore them. Listen to your body and seek medical help immediately. Always take antibiotics exactly as prescribed, never more, never less. And remember, this video is not medical advice. Only your doctor can decide what treatment is safe for you. By being aware of these risks, you can protect yourself and your loved ones. Stay informed, stay safe, and always put your health first.